And I've just received a thumbs up from the back of the room, so I think we should probably make a start. Welcome then to everybody in the room and everybody online to the CRE Respond seminar on sepsis today. My name is Adam Irwin and I'm an NHMRC Emerging Leadership Fellow here at UQCCR. And I'm also a Senior Medical Officer in Paediatric Infection over at the Children's Hospital. I happen to be the medical co-chair of the Queensland Paediatric Sepsis Programme as well, which is a statewide quality improvement initiative that aims to improve the outcomes of children with sepsis. I'd like to start by acknowledging the traditional custodians of the land on which we meet here, and for those of you online. For us here in Hurston, it's the Turrbal and Yagara peoples, and I'd like to pay my respects to elders and descendants who continue important cultural and spiritual connections to country. Now, sepsis is a syndrome of life-threatening organ dysfunction caused by a dysregulated host response to infection. It's got an enormous global burden, and as a paediatrician, I want you to know that there are approximately 25 million episodes of sepsis in children under 5 each year that cause 3 million deaths. And it's a medical emergency for which delays in effective treatment lead to adverse outcomes. Now, I'm about to commit heresy. Here at UQCCR, the home of the International Antimicrobial Clinical Trials Marino and Bling, I'm going to tell you that if you really want to make a difference in sepsis outcomes, if you really want to change the game, then it's all about early recognition. A failure to recognize sepsis was the leading cause of preventable harm in the 2 most recent Queensland Paediatric Quality Council reviews of serious adverse events in hospitalised children. Major parent and carer escalation systems like Ryan's Rule here in Queensland and Martha's Rule, which has just been enacted across the whole of the NHS in the UK, have been implemented as a consequence of a failure of clinicians to recognise deterioration attributable to sepsis in children and young people. And so today I want to introduce 2 talks and 2 speakers whose focus is going to be on how we can improve the recognition of sepsis and deterioration in patients across Queensland.